and PAIVMs are used, or it's really pain provocation test. So it's passive accessory intravertebral movements. So we're going to apply the pressure either through the spinous processes, either through facets, or transverse process, looking where the pain is coming from in the patient. And to be honest, when we look at the treatment, you can treat me tomorrow. I think I'm going to be ready for treatment. So I'm going to teach you, and some of you can treat me. And you can reassess me. I'm looking forward to it. So the arrows, guys. So if the arrow is in the middle, like just one arrow straight down, that means it's central PA, and that means on the spinous process. Okay? And if you've got this arrow, unilateral PA to the right, so that means either facet or transverse process, and that would be unilateral to the left, either through facet or transverse process. So this is kind of what we're looking at, yeah? So we can either apply PA through the spinous process, looking where the pain is coming from, but also looking either through the facet or transverse. So if you look, for example, if you want to push on the transverse process of L5, which is here, would be at the level, so if you've got L4, L5, so the transverse process will be at the level of spinous process of L4. Can you see that? This is just, the anatomy here. And if it's, let's say this is, so if it's, if you want L4 transverse process, you find will be between the level L3, L4. So L3 transverse, L3 spinous process will be at the same level, a bit more lateral, L4 transverse process. Okay. Now, when you apply pressure, I think what's important to know from the patient is this pain familiar to them? Because we apply the pressure and they say, oh yeah, it's painful. It might be just a pressure pain. So if it's only a pressure pain, it's irrelevant. We're looking, when I push on this level, on this spine, does that provoke your familiar pain? I think that's important to ask. Okay. Now, other thing is, if we have couple levels that are painful, you want to know which one is most symptomatic, which one is really most that you think is provocative for you. So then we can focus in terms of treatment on that most provocative. Because sometimes there are 2 levels, or even 3 levels that are provocative. But which one is the most? That driving that nociceptive input into the nervous system and causing pain. Okay, so what's next we have here? Okay. Now, remember why when we talked about the sin, high and low sin? And remember, if you got high sin, we would go away from pain. And if it's a low sin, we can go towards the pain. So the patient's got low sin, we can apply PA pressure in the primary movement and then in combined position as well. So we can go into that provocative movement plus apply pressure on either facet or spinous process. But in this patient, we know that, let's say, flexion was painful, let's say PA on L5 was most painful, and sliding to the left, it's even worse. Then we expect, when we put the patient in extension and right side bending and repalpate L5, that should be to somewhat more comfortable. Yes. So we see how that's how it's flowing into that from the combined positions, so the combined movements into those combined positions. So either going away from pain, or if they can tolerate, we can go towards that painful movement. Okay, so let's not worry about this for the moment. Let me show you a bit of an assessment now, okay, of that pain provocation test.